Home Health and Hospice Part 2. Personal safety. Get to know the neighborhood that you're going to be seeing the client in. Make sure you dress in sensible shoes and simple clothes. Avoid long necklaces, expensive jewelry, and pins of religious or political nature. Know your client. Always note a history of violence. Keep your supervisor informed of potential violent situations. Have safety accessories in your car, cell phone, flashlight, and keep it well maintained. Know the agency policies and follow them. Lock up equipment and valuables in the trunk of the car before leaving the agency or the home. Set goals together. Clients are more likely to own the goals and try to achieve them if they are involved in the goal setting. For the environment, the physical and social environments, background noise, crowded surroundings, and interruptions by other family members could impact the visit. Behaviorally, it is employed by the client to distract the nurse from the purpose of the visit. They may think it's more social, but you need to stay on point. Nurse-initiated fears, role preoccupation, and personal reactions to different lifestyles, put off by the contrast of different living styles. Evaluate the home visit. Interventions are appropriate to the situation and client response, which may take many visits. This is where the need for advocacy from the nurses is needed for the patient. Reflect on the level of healthcare involved and evaluate the use of the home visit process. Follow-up to a home visit involves documenting what took place. Accurate documentation is essential for reimbursement of services. Documentation should include the actual assessment of the client's health, identified health needs, goals established and interventions to achieve the goals, client's responses to the interventions, future plans of care, discharge summary of the interventions used, and the client's health status at the close of care. Referrals may be necessary. Termination of the visit may continue over an extended amount of time. This will necessitate planning for termination of services and begins at the very first visit. Reminders of termination of visits should be provided at each visit. When the services are truly ended, review is done with the client of the achievement of the mutual goals with the client and make referrals for continued care if needed. The caveat to this is not all clients will have services terminated. They may be long-term clients. For example, the clients with spina bifida, quadriplegics, multiple sclerosis, and any clients with chronic care limiting conditions. Home health is defined as an array of services for people of all ages provided in the home, in any community setting, that encompasses health promotion and teaching, curative interventions, end-of-life care, rehabilitation, support and maintenance, social adaptation, and integration and support for the family caregiver. This is defined by the Canadian Home Care Association 2009, pages 21 through 22. Responsible for the achievement of designated outcomes of care, this may also have a specialization in hospice services. Hospice is the program of palliative care and support services provided to terminally ill clients and their families. Palliative is providing the purpose of alleviating symptoms, physical, psychological, or spiritual, associated with terminal or chronic conditions, rather than promoting a cure. Goals provide services need to restore the client to optimal level of function given the constraints of the chronic conditions. Provide symptom relief then until death. The client's need for home health or hospice must be certified by a primary care provider in order to receive reimbursement for services. Particular need for close collaboration among the client, nurse, and primary care provider and other healthcare professionals. Home health hospice nurses may make referrals for additional services to meet the client needs. Technology can be very sophisticated in home settings. It requires home health to be knowledgeable about high-tech equipment and procedures. Funding for services is derived by public insurance programs such as Medicaid and Medicare, private insurance out-of-pocket spending by recipients of care. It is likely that the need for home health services will increase in the future for several reasons. The acute care settings will continue to attempt to reduce costs by shortening the lengths of hospital stay. The increased rates of chronic disease as an aging population necessitates assistance to prevent institutionalization. Advances in technology makes provisions of highly technical care possible in the home setting, and majority of the population would prefer to receive care in their home rather than in an institution. Medicare is the largest single payer of home care services, and the clients who are homebound and under the care of a physician are eligible for home care under Medicare. Home Health Resource Groups, or HHRGs, has where the client is placed in one of 80, determine the rate of pay for an episode of clients, and the flat rate of reimbursement for all needed nursing and home care visits during an episode of care. Private pay may also be involved. The National Association for Home Care and Hospice is the largest home care trade organization in the country, with a mission to improve the quality of home care services, evolved into major industries with 3 components: home care agencies, home care equipment vendors, and home infusion therapy companies. There are various types of home care agencies. The official home care agencies only provide service certified by federal government, which mandates. Hospital-based agencies have no mandate and can offer service for their own choosing, or Medicare, Medicaid if they are certified by the federal government. Proprietary agencies are freestanding and for-profit care agencies that provide services based on a third-party reimbursement or self-pay. Private duty agencies that primarily provide shift relief at healthcare institutions and for private clients are generally described as home care agencies. Eligibility requirements are Social Security benefits, certification need for the care and care plan. This plan of care has to be recertified. The client must be homebound, and they need at least one of the following: intermittent skilled nursing care, physical, speech, or occupational therapy, skilled observation and assessment, and then case management and evaluation. It starts with using Outcome and Assessment Information Set, or OASIS. This is a system of assessment and documentation developed to assess patient needs and outcomes of care by Medicare home agencies. There are 5 target areas: effectiveness of care, efficiency, equity, patient-centeredness, and safety. There are different data sets according to if it's a start of care, recertification, transfer, resumption of care, or discharge of care. There are 23 questions, and you use the Form C assessment. Some areas require a certificate of need prior to licensing a home health agency or other types of services. Accreditation involves meeting more rigorous standards for quality of care and performance standards. Standards have also been established for home health nursing education. A model curriculum is available at the Home Health National Nurses Association website. Evaluating home health and hospice cares must be undertaken at both aggregate and individual levels. Individual level is similar to the evaluation of all home visits. OASIS system is used to promote documentations that support assessment of care outcomes at both individual and group levels. OASIS documentation suite includes several documents required of home health agencies that receive Medicare reimbursement. Components of the suite includes the Start of Care OASIS, which is a standardized assessment form used at the initiation of care, the reassessment, which is conducted between the 55th and the 60th day if care continues into another episode, and the Discharge OASIS, which needs to be completed at the end of care and within 48 hours of the last visit. With these documentations, OASIS measures the outcomes, process, and potentially avoidable events. One of the functions of OASIS documentation suite is to permit home care agencies to assess their care comparative to other home care agencies. This is done by several reports that are generated by the OASIS system. The Outcome-Based Quality Monitor, which is agency patient-related characteristic reports, potentially avoidable events reports, or an outcome-based quality improvement. Again, agency patient-related characteristic reports, the OBQI outcome report, which is the health status over time for 37 outcome measures, the patient tally report, which is information about each client included in the outcomes report data, and permits agencies to select clients for process investigation purposes. The CMS also provides process-based quality improvement, PBQI, outcome-based quality monitoring, and quality improvement manuals. This assists agencies in the interpretation and use of evaluated data for program improvement. Let's talk a little bit about the lay caregivers. You have learned when caring for a client or patient that it includes caring for the family or the lay caregiver. Lay caregiving is one of the world's fastest growing unpaid professions. 80% of home care services provided by lay caregivers. Family and lay caregivers are important members of the client's healthcare team. The stress and demands of care for a loved one 24 hours a day, 365 days a year, takes a toll on family caregivers. Caregiving includes providing emotion support, direct health care, financial support, mediating with health and services organizations, sharing a household. It may include tasks such as bathing, toileting, shopping, preparing food, feeding, maintaining a household budget, and housekeeping. Family dynamics vary. The nurse should not be judgmental about choices families make. An important role for the home care nurse is assessment and support of the lay caregiver. The typical caregiver is middle-aged, married woman who is employed full-time and is also spending about 18 hours a week caring for her mother that lives nearby. This means she might have caregiver stress. Caregiver stress is social isolation, decreased preventive care, depression and illness, lack of support, demands on time and energy. When assessment is needed, the caregiver must be present, availability and assistance is needed, knowledge about the physical and psychological status. To intervene, you must enhance the quality of life, allow adequate preparation for ongoing needs, organize respite care, reciprocity, communicate and educate, and help the caregiver find support programs. New trends focus on practice, including client care, pharmacology, best practices, and cost-saving clinical approaches to client care. Improving standards of practice through education strategies of practice rounds, journal clubs, increased library holdings, expansion of orientation, and teleconferences. Changing emphasis of care to accentuate empowerment with families and clients that individualize the care plan. These are some of the services seen in given home settings. Starts with infusion therapy, where infusion therapy includes chemotherapy, pain management, fluid replacement therapy, immunosuppressive drug therapy, inotropic therapy, and blood and platelet transfusion. It's widely used as cost containment strategy. Reimbursement criteria are strict. Pre-authorization is essential prior to initiating infusion therapy in the home. Increased expectations for families to administer medications and fluids through the central line. They need for sharp problem solving and interpersonal skills, detailed knowledge of therapies and their effects, and technical skill in working with equipment. Direct caregiving or delegating medical function, safety assessment and education, and pre-approval and documentation. Wound care is a common specialized home care function that includes advanced training, education, and certification. Wound classifications are acute, chronic, familiar with the wound type, wound care orders, cleaning method, and frequency of dressing change, as well as pressure relieving or support devices. Dietary restriction and caloric intake, medications, and activity orders and restrictions. Ongoing evaluation of wound and risk factors for healing. Preparation prior to first visit. Main functions are delegated medical functions, consultation, counseling, collaboration, and health education. Mobility enhancement and pain assessment is also needed. Documentation is a must. There are trends with interdisciplinary teams and networks. Care conferencing, telehealth, telewound, photography, and wound electronic medical records. There's increased use and increased need for nurses with this specialty skill set. Maternal child are high risk, such as hyperemesis or protracted vomiting with weight loss and fluid electrolyte imbalance, which may require IV fluids at home to maintain hydration. This is to prevent premature birth in women at risk for preterm labor. You need to assess the mom's weight, fetal heart tones, fundal height, nutrition, psychosocial status, compliance with the plan of care, and knowledge of signs and symptoms. The trends are telemedicine use of case manager model of care, research and evaluations, with 3 categories: high-risk pregnant women, high-risk infants, and children. Many depends upon the client's condition, includes assessment, health education, skilled nursing care, delegated medical functions. Pain management is often where pain is underestimated and inadequately treated. Establish relationship and trust with the client and family. Comprehensive pain assessment and prevention early interventions. Decrease and eliminate the barriers to effective management. Delegated medication functions, health education, consultation, case finding, referral, counseling, and advocacy. Also use of alternate methods of pain. Also use of alternate methods of pain management. Relationship and trust between client and nurse is central to the process. Effective pain management is based on comprehensive pain assessment. Imperative, the nurse develops assessment skills and pain management trends. Increased use of complementary therapies and increased use of various technologies. Research and evaluation of pain management and strategies and interventions.